Usually, something like depression doesn't just hit you out of nowhere, it builds up over time. You may be getting no sleep these days because your mind is so consumed with thoughts at night. But life goes on though, so you have to put on this facade for everyone that you're doing completely fine, when really you're not. In your school of thousands of students, you still have no friends, nobody to talk to. Everyone around you seems to have their life all together. You feel like an imposter. You haven't been able to focus much on school these days, therefore your grades start slipping. You can see your future crumbling before your own two eyes. You had big dreams, but now you start to doubt yourself. You know you've disappointed your parents because you're not doing so well in school anymore. You can barely eat anymore these days. You never have an appetite. Social media is no longer an escape from reality. It adds fuel to the fire, gives you more thoughts that'll consume you. When you're in a poor mental state, things that didn't bother you before start bothering you now. You become self-judgmental and overly critical of yourself. It all starts to get too much for you. The thoughts are getting out of control and you need a break. But life goes on. Society is unforgiving. So many factors are causing your depression. You have to worry whether or not you can pay for rent, groceries, or your tuition fees this month. Your assignments are piling up, but exams are also soon. Social media is always reminding you that you're not pretty enough. You have to worry whether or not you can get a good job after school. Your family is constantly stressing you out because they have high expectations from you. You're losing your friends. You're reaching your limit. You recognize you need professional help to deal with what you're going through, so you reach out for help. And you tell them you're suffering and need to see someone as soon as possible, but you're told to wait. One of the biggest barriers to people getting the help they need is the long waitlist times to get treatment. When there's such a high abundance of people who need professional help, but insufficient resources to accommodate them, a backlog begins to develop, causing those in urgent need of help being unable to receive it. Long wait times to see a counselor is a barrier to accessing mental health care and therefore has a negative impact on health equality. Repercussions of these long wait times are that waiting months for treatment can cause people's mental health conditions to worsen, which can result in negative outcomes such as increased risk of suicide and decreased quality of life. Long waitlist times can also unfairly affect certain groups of people, such as those with lower income, those who live in rural or remote areas, and those who belong to marginalized communities. These groups may already face additional barriers to accessing mental health care, such as lack of transportation, stigma around seeking help, and discrimination. Long waitlist times can exacerbate these inequalities and make it even harder for these individuals to access the care they need. Many fail to realize the serious consequences of long wait times. The biggest consequence of delaying professional help is the risk of suicide. Mental illness doesn't wait in line. It continues to eat away at the individual, which is why acting fast could save lives. To achieve health equality, it's important to ensure that everyone has access to the mental health care they need, regardless of their income, location, or background. This means addressing the issue of long waitlist times, reevaluating funding to mental health care, and implementing policies and programs that improve access to mental health care for all individuals. We must work towards a day where you don't have to wait in line to be saved.